I don't think so. I think we're good. All right. If there's any seats up there, if there's a seat next to you, if you could raise your hand so that the people that are standing in the back can sit down. There are a few seats down here. If anyone wants to come down and get the action straight up, there's a seat over here. All right. All right. So good evening. This is a great crowd. It's excited. On behalf of IST, College of IST, and the College of Health and Human Development, we welcome you to the second PSU mHealth Challenge. Okay. This is a cross-college challenge where we have biobehavioral health students come up with a societal health problem, identify a target audience and a behavior they want to change or adapt, and we pair them with IST students whose responsibility is to translate that into a mobile app that can actually fix the problem or help to solve the need. Okay? They've only had about 2.5 weeks to work together as a team, so they've done quite an amazing job in that little amount of time, and you'll see that in a moment. We have 6 teams, and they will each have 5 minutes to present their idea, and they will get 5 minutes for questions from the judges, and then we will also award a first, second, and third place. So I want to introduce our wonderful judges. We are down one judge. Unfortunately, Mary Good was not able to make it, but we will not be lacking in wonderful judges. So we have John Kim. John Kim is visiting us from the West Coast. I'm sorry for the rain. You know, we do the best we can with the weather here. But, you know, he has started and built multiple mobile health businesses. He's CEO of Dr. Base and founder of 5-9. He also works with startups, mentoring them, and has done his share of competitive competition. So welcome to John Kim. His fan club is here. We also have Todd Erdley, who's founder and CEO of Videon. Their mobile app, Avaya, right? Avia. See, it's the syllable thing. Okay. Recently was the #1 downloaded for the month of December on Android, so that's quite an accomplishment too. He is also the leader and inspiration behind 3B33 in terms of trying to help economic development here in Happy Valley, and he founded and runs CREN, which is the Center Region Entrepreneurship Network. It's great for students. He's very student-friendly organization, so look for that if you want to start mingling. Okay, so without further ado, we're going to start the competition, and our first team up is Beat the Beats. That is Ryan, Brett, Matt, Keely, and Caitlin. Get it? It's not. All right. So that. One of these is weaker than the other, so you have to hear yourself. All right.
Hello?
No.
Can everybody hear me? Excellent.
Will you cue them when to go? Do you want me to cue them?
Whenever you're ready. Jonathan tuned it last time.
Okay. All right, when you're ready, you can begin.
All right. Hello, everyone. By quick show of hands, how many of you know somebody who's been affected by diabetes? Okay, that's a lot of hands. All right, for those of you who don't, chances are you're going to know somebody before long. Tonight, we're pitching a mobile application called Beat the Beaties, which hopefully will help fight type 2 diabetes in children aged 10 to 12 years old.
Diabetes is a health issue concerning high glucose levels in the blood when either your body fails to produce insulin or stops responding to it. Type 2 is the form that's caused by an unhealthy lifestyle. People develop it over time, and poor diet, lack of exercise, and being overweight all increase one's risk of developing type 2 diabetes. There are nearly 26 million people in the US right now that have diabetes, and 80 million that are pre-diabetic. Type 2 is the most common, with 95% of the cases being type 2 diabetes. It used to be considered adult onset. However, the prevalence of diabetic children who are type 2 rose from 2% in 1985 to around 30 to 40% in 2005. Prediabetic symptoms actually start becoming evident around age 10.
So there are many factors that contribute to type 2 diabetes in children. However, our application, Beat the Beaties, is going to focus on changing the actions of these diabetic children or before they get diabetes. And it's going to focus on changing their actions by using the social cognitive theory. Our solution is to make our users aware of the consequences by showing them about diabetes and what happens once you get it, and also how we are going to change their cognitive understanding on nutrition and exercise. Together, these aspects can change their behaviors and beat the diabetes. We decided that doctors could suggest this application to their patients. Whenever they come in and they're overweight or have a family history, the doctor could tell them to go on and download this application. I've actually spoken to a pediatrician named Dr. Kate, and she said that she would actually endorse this to her patients because it is encouraging, it is motivating, and she would recommend it to about 25 of her patients.
This slide shows how we will increase knowledge about the disease and the role that nutrition and exercise plays into it. The diabetes quiz up there to the left is for the purpose of providing the users with the opportunity to gain more knowledge about type 2 diabetes. This quiz will be set up in a fashion where difficulty is meant to be easy to ultimately further knowledge. The facts of the day portion up to the right will be presented as push notifications for users and will provide a sentence or two that teaches them a diabetes fact. We chose to give this as a push notification to also serve as a reminder to use the app every single day. Once they have taken the quiz, they will put their knowledge to use by completing the food and exercise logs. They will help users and doctors keep track of how well the users are accomplishing their goals and letting them calculate how many fruits and vegetables and exercise patterns they go through daily. These logs will also help play into the treasure map feature of our application.
Okay. We will look to motivate our users to continue using our application in 3 ways. First, through the use of weekly challenges. These challenges will be small, specific tasks that users can complete over a week. Second, we will have a treasure map game included in our application. The goal of this game is to have users advance from a starting point to the treasure chest marked by the X. They will accomplish this by completing smaller tasks than the weekly challenges, or they can access shortcuts in the map by doing a little more in the challenge, for example, running instead of walking. By completing weekly challenges, completing the treasure map, and logging on each day, users gain points. These points will be added into a leaderboard, which will include their friends. We wanted to add friends into the application because we feel like creating a community and letting them go through the experience with someone else will help make these changes that they're going through with diabetes a little easier.
So we feel that our application has provides a good chance for making these kids believe that they can make changes in their lives. So our next step that we want to take is we want to develop a working application, a good prototype, and actually work with kids and see how they respond to it. As she mentioned, Dr. Kate, she actually advocated that there was 25 potential users that she would pilot this program with. So that's a good next step for us. So I think that's about all we have, and we're ready for questions. Thank you.
One of the things that you talk about is a food log entry and an exercise log entry. This is really forcing behavior on the user's part. And I find so many apps that are based on food or exercise entry, that to be the very cumbersome interface. How are you going to get people to do that? Just walk me through how I start to enter my food or my exercise activity.
We envision these logs as a very simple, almost drop-down menu where you would they would just have the basic categories of like fruits and vegetables, and it'd just be like 1 serving, 2 servings. It would try to be a little bit more simpler since these are kids, and plus they be tied into the weekly and daily challenges. So like a weekly challenge would be eat 5 servings of fruit this week. So it would kind of encourage them to use the food log.
By the way, great job on getting outside the building and actually talking to physicians. That's great. That's actually, I think, the most important thing at any kind of idea stage. So great job on that. And you guys did a really good job articulating the problem. You know, this problem is kind of like the American health problem, right? I was talking to a professor at UCSF the other month, and she said they predict that by 2030, 1 out of 4 children will be obese. 1 out of 4, right? So it's a giant problem you guys are trying to tackle. But I think everything we've seen so far in terms of creating mHealth apps for the diabetes market shows that the problem isn't creating the game. The problem is creating a sticky interaction where they will want to come back, right? So you can imagine that 12-year-old kid that has Temple Run and whatever many distractions on his phone may not want to report on a regular basis what they're eating, right? So it's really about the challenge of sure, the doctor can prescribe the app. How do you get this kid coming back 2-3 times a week, sometimes 2-3 times a day, right? Have you guys thought about engagement and how you would keep that level of engagement?
I thought about the same thing. I'm sure everybody's heard of Flappy Bird, and it's pretty much the dumbest game that was, ever created, but it was just something that kept bringing you back. And we obviously, this is kind of something a little different because you're, dealing with food, and we were talking about it, and one thing we wanted to do, we wanted to give the users points, or we talked, I don't know if we mentioned the leaderboards and like sort of the social interactivity of it, but we wanted to award points to users who kept coming back on consecutive days. So if you go, start on Monday, you get 5 points. You go on Tuesday, 10, Wednesday, 15. And that's just like one of the little things, but obviously what you're talking about is one of the issues, but we want to definitely develop a way or a better way to keep the users coming back, to keep them engaged.
But I guess that leads to the question, are points enough? Do points constitute engagement, right?
That's a good question.
I do agree with you that that's an issue, but I think what we were trying to do to add to the points is to try to create that community. And I think if you think points aren't enough, maybe competing with friends is an addition to points, or working with friends is an addition to points, maybe something.
Also, diabetes is usually runs in families, whether it's, especially with type 2, it's usually environmental. So we were thinking doctors probably work with families and how you could have siblings compete, and that's obviously going to be very competitive. We try to make it more of a game with the treasure map. I think it's definitely a good start, and if kids weren't as responsive as we'd like, if we would try it with the 25 patients that the doctor we know had, then we could work more with it and see what they liked about each aspect of it.
This point about engagement is, I think, really the hardest problem to get to really roll forward. As far as our app, our experience is that after a person downloads the app, if you have 30% of the people retain your app and actually use it going forward, that's a really, really, really big number. So what will happen is people will download the app, they'll play with it, work with it, interact with it for a period of maybe a week, 2 weeks, 4 weeks, and then you see the utilization model drop off precipitously. So there has to be some other level of engagement. And one of the things I would suggest, if you actually would carry this forward beyond a class, is to actually have an engagement with the physicians, with WellCare facilities, to see if you can provide monetary, and monetary could be as easy as some sort of gift card or what have you. It could be a lot of different things where getting those points translates into a benefit, because the benefit of keeping a kid away from type 2 must have a value proposition, and that would have been one place where I would have really liked to see more, to say by keeping somebody off we could save society X, and because of X we could invest Y. That would have been interesting to me.
Okay. If time for one more question if you want. If not, we'll torture the next team.
So how did you find this pediatrician?
So last summer, I shadowed her. I was planning on being a PA, and she works for Northside Christian Health Center in Pittsburgh. It's inner city. So she deals with a lot of children who are from lower income, which is very prevalent. And she said about 35% of her patients are overweight or their family history. And of that 35%, she said there are 25 children that she would pilot this app to, that she agrees that it would motivate them, it would encourage them. And I asked her about the point system. I said, do you think that it would actually be beneficial? Do you think it would help? And she said that I think that if you engage them enough, that they would keep coming back. And the fact that she told me how it was very important for these children to have something to engage them, because what she usually does is she sends them to an office. It's called CHP. And they talk about like nutrition to the family and to their parents. But usually the kids in the families that I saw last summer, they aren't very into like going to a different doctor than they already have. So she said that the fact that we would present this application to them and that they could engage and learn about diabetes, that fact of the day, they had all these challenges, that it would definitely engage them.
Yeah, that's, it's really interesting because children with type 2 diabetes, their parents and that entire family unit behaves very differently to the disease if you're inner city versus if you grew up in like a wealthy area in the suburbs. So that's interesting. I think you went to a physician that's kind of at the heart of the problem. Great job.
All right, thank you so much. All right, now we have team 2, team Look Inside. Meetin, John, Krista, Glenn, and Emma. Go ahead and whoever's getting this up. Pull your thing up. You have time. So there's 2 mics. You can.
Thank you.
One of them is a little quieter than the others.
Yeah.
Talk up.
Okay.
Can you hear me?
I think they're good.
Perfect.
We'll wait. So I'm going to give you, I'll let you know, because they're still, the judges are still.
Okay, yeah, that's fine. I thought she said let's begin, but
No,
she
no,
said
no.
yes, we can. I was like, what?
Ready? Okay, whenever you're ready.
Would you be willing to use a product for yourself or for a loved one if you knew it was linked to a possible diagnosis of cancer? We all know the risks of smoking and UV ray exposure, but what if I were to tell you that the personal care products that you use every day can be just as harmful to your health? Americans spend $40 billion a year on personal care products. Men typically use 6 personal care items with their morning routine. Women, typically 12. 70% of consumers that we surveyed believe that the FDA or a similar government entity is responsible for monitoring the personal care products that are on the market today. So why worry? In truth, it is the personal care product companies that are solely responsible for the products that are on your market. Of those, the products that are on the market, of those products, 1 or more ingredients, and 99%, have never been assessed for public safety. And exposure to those toxins has been linked to health concerns such as cancer and eczema. So we use the public health theory called the health belief model. The key concepts of this model are the 4 Ps. So for the user who wonders if they are at risk, Look Inside shows the user that the products we use every day contain ingredients that are not fully understood. Our app educates the user of every ingredient's severity, whether safe or harmful. By educating the user, they will understand that safer products are easily accessible at local stores or to be made at home. By providing alternate products and do-it-yourself options, our app removes potential barriers for users to make healthier choices. The target audience that we chose was expectant mothers who have attended their first prenatal physician's appointment. At this appointment, they receive a packet of information that was compiled by their local childbirth education association. This is how we will disseminate the product to the user. We chose this population because women make 80% of all consumer buying decisions in the home. And pregnant women are highly motivated for their own health, for the health of their baby, and be more prepared for the events to come. These women will be the early adopters of Look Inside.
So during our research, we did find a couple apps that are getting a lot of traction right now. But what makes our app different is that it's unbiased and it's easily infused into the user's existing shopping experience. In addition, we recognize that target audience is extremely busy, so it has to have a low learning curve, and it has to be very intuitive. In this social media day and age, the users also want to connect with his or her friends in the web space. So by sharing the tip of the day on their Facebook or Twitter, they're able to spread awareness while connecting with like-minded users. Now let's walk through Allison's shopping experience, who has a 3-year-old daughter and has just found out that she's pregnant. She's walking through her favorite store, trying to purchase personal care products for her 3-year-old daughter, Sally. Both of them have profiles on this app, which is controlled by Allison, and both of them have personalized conditions associated with their profile. So as she's walking down the baby shampoo aisle, she scans the Johnson & Johnson baby shampoo, which is what she usually gets for her daughter. The scanning process is very easy and takes very minimal time while she's shopping. The results she gets are very eye-opening, as her child has eczema, and some of the ingredients in this shampoo also flare up her condition. The result page shows her the ingredients that are bad for Sally, and any alternative products that can be good that are good for her. Also, something that Allison didn't know, which was that she could make these baby shampoo products easily at home by herself. When we were talking about building this app, our vision was that this app would result in consumers making wiser, more educated decisions, and decisions that would help not only themselves, but their children and their family in the long run. In addition, what most users don't know is that many products can be built at home with the right direction, and this app does exactly that. As mentioned earlier by Glenn, the problem is so multifaceted that one of the best ways to solve this is by making the consumers more educated about this. The final goal is to increase users' ability to buy safer products and products made at home. But after Allison's shopping experience, she's so impressed with this app that she decides to share her experience with her friends, allowing them to make well-informed decisions with her. Thank you, and now we can take any questions that you guys have.
So let's go with the cynical approach. My wife has been married to me for 25 plus years. She learns through your app that by me using Old Spice deodorant, she can kill me off. Quantify for me what the real impact is. Will I die because of Old Spice deodorant? How fast will I die? And how important is this to her? You're not married, you won't understand this.
I can't speak for your wife, however.
Thank you very much.
It is the continued exposure to a lot of these toxins. So there are increases, especially with something like a deodorant or whatever that has a perfume in it, that there will be increase in hormonal cancers based on that. I don't have specific information regarding what your lifespan will be if you use this once a day, twice a day, or if you've only been using it for 10 years or if you've used it for 25. So we don't have necessarily specifics, but the cumulative effect has been shown to have some of these diagnoses that come from that.
So is there, in general, then, a qualitative or quantitative way of assessing what the impact is? Because I'm just trying to get my head wrapped around that there is a qualitative impact. This goes back to maraschino cherries having red dye, blah, 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 many, many, many moons ago. It reminds me of that.
We don't have the specific quantitative data because I don't think it's actually available. We're still in the process of finding years and years, but the point of our app was just simply to make people more aware that this is happening in their daily life. Not so much if you use this, it's going to happen.
Yeah, also just to add to that, while we were creating this app, from the technical side, we wanted to get a more in-depth we want to do enough research on it. So we actually talked to a cousin of mine who works for L'Oreal, and not anymore, so he could tell me all this inside information. Right. But he said the same exact thing, that the users don't know that the products that are inside these ingredients of these things can cause you cancer or any sort of these things, but it happens. They know that the chemicals that they produce in them are really bad for you. And actually, the companies themselves now know, because the employees themselves are now facing all those issues because they've been using these chemicals for years and years making the product. So it's out there, it's just not quantitatively out there.
But I want to congratulate you from a marketer's perspective on the logo and the name and the font. You guys did a really good job there. That was you? Okay. I see a future marketer there. If you're looking for a job after graduation, talk to me. No, really, that's impressive. I think that can't be overstated. While you can't right, what these types of chemicals, like in a receipt, do to you, I do know that, at least in certain states, liberal ones like California, it is becoming an increasing issue. In fact, the EU is actually looking to make, much tighter restrictions in the United States. And there's all sorts of kind of lobbying going on both sides, right? But I don't know that you guys address the real puzzle. To me, the real puzzle is who's going to create this content, right? Like, so if you've ever gone to a doctor's office, if any of you guys are all young and healthy, but if you've ever gone to a doctor's office, in many states now you're required to get a pamphlet. Like, so if you have eczema, right, someone has to hand you a brochure that says, what is eczema? How do you treat it, right? That content, I mean, it sounds kind of astounding, but the company that creates that content is called Wolters Kluwer. And it'd be hard to imagine that the company that creates those brochures is worth $5.5 billion, right? That's how big the American healthcare industry is. That's not to say anything bad about Wolters Kluwer's. I'm a big fan. But that content has it's taken decades to produce, and it's peer reviewed, meaning a doctor's written it, other doctors have looked at it. So when you say that baby shampoo is potentially an exacerbator of eczema, who's creating that content? Who's uploading it? Who's peer reviewing it? How do you have plausible deniability when the inevitable wave of lawsuits come? To me, that's the real puzzle, right? You guys have identified a growing trend of awareness about these products, but who creates the content? Have you guys talked about that?
So I can answer from the IT side as well. There will be like a user feedback area where, let's say if a doctor is using it or something and they find out that maybe this ingredient is not the direct causation of it, but when this ingredient is used with some other chemical or some other ingredient, then it's a causation for eczema or whatever. Then the doctors can give that feedback, and we can accordingly change it, that we can put it that particular ingredient is used with this ingredient is a causation for eczema or whatever, cancer or whatever it is. But from BBH side, yeah.
I mean, I agree with you. I really saw that as being the problem, just because if we were to take this forward, I personally don't have this knowledge in my back pocket. But I believe that the certain ingredients and what they do link to is out there, which is why that's what we really focused on highlighting. Also, there's other apps out there that almost bombard you with too much information, and it's overwhelming. And we didn't want to overcomplicate things, so we really just wanted to focus on the ingredients and what they could cause as an awareness thing to increase their education.
Most of the literature that we found had a lot of what they were finding in the urine of babies and as well as adults. But they start to focus on when babies are being born with 300 known toxins already in their system, they want to know how this is all going on. And some of this we're only seeing because a lot of these chemicals just kind of came forward since the Industrial Revolution. So we're just seeing people who've used these products, also with the onset of convenience items and everything, we're seeing just now people who've had that continued exposure for years, which is why some of the data is new and just coming out there. But there was a lot, I mean, we pulled a lot of articles, and in regard to what they were finding, had a lot to do more with the parabens and phthalates, which you'll hear a lot about, BPA, things like that. But that's about where they are, I think, now with where that's coming from.
And the final comment, judging a lot of these competitions or helping my friends kind of decide who they're going to fund. I think so many startups make the mistake, even at this kind of informal idea stage, of saying their customers are going to be the world, or men, or women, or teenagers. And what you guys did that was different and so right was you identified who your first niche demographic is going to be, mothers, which I think is spot on. So great job.
Thank you.
One last question.
So, you guys, I think that he hit on the exact right thing. You really are targeting the correct market. But here's my ultimate question. Are you trying to change behavior in what products people use, or are you trying to change behavior into helping people to identify do-it-yourself kind of processes that go around what the industrial products are, and really encourage a different level of behavior where people are much more engaged, like organic farming and CSAs and things like that? Which way do you really ultimately see this leaning?
As I said before, awareness was really important to us, but we also wanted to empower our customers to know that they could do this on their own, that they when Glenn came to me with the initial idea, I was just dumbfounded at what was in our products. And knowing this information and knowing that it's possible to create it yourself is so empowering. And ultimately, we want people to be able to make the best choice for them, whether it is just using a safer product or making everything from home. My aunt kind of went on this trip lately, and she makes everything from toothpaste to laundry detergent, and she not only has felt healthier, felt better about herself, but she saved money, which is also something big for expectant mothers. So.
I really like that angle.
The mic is being not nice, just so.
Now I think I got something. So I like the DIY angle. I think that that's a great angle because it kind of says, hey, this is a little bit bad over here, but why don't you do this? And this is really good, and you can be assured of that. Because as soon as you start recommending alternative products, boy, I can't even imagine the liability thing. That just freaks me out. So.
Actually, the last point that you made was exactly the reason I wanted to take the DIY approach, because it becomes, most of the other ads that we looked at were biased in the products that they showed us, and we wanted to be as unbiased as possible, and the best way to do that is do it yourself. So that's, you hit the point.
Thank you very much. Right. Okay, next we have Team EMS. Mark, Max, Caitlin, and Doug. Okay, and you're gonna, whoever's gonna get your, who, I don't know who, you want this?
Let's get our slides up first. So just
I will let you know when to start. Okay.
Thank you.
Thinking it's one of these.
Can we use, is this a clicker?
Yeah.
This is a clicker there. I wish there were slides so we could read it off the back. I'm going to try to remember what's on it.
Hello, hello.
Yeah.
That's right. All right, whenever you're ready.
Okay. Hello. Thank you for coming to the mHealth Challenge. Today, myself, my name is Doug. I'm here with Max, Caitlin, and Mark, and we'll be talking about the Biometric Healthcare for Emergency Medical Services app, which we are calling BEMS. Thank you. Okay, so I've had many different jobs, and one thing that they've all had in common is that at some point we were short-staffed. This includes my time as a paramedic in Chicago. One thing that we know is that EMTs work under stressfully shorthanded environments, as with one difference from the other jobs, that actual lives are on the line. We believe that any tool that will help us save time and reduce confusion is wildly beneficial. My very first call was a bus accident where we had two adult males actually go through the front windshield of the bus. When we arrived on the scene, the two gentlemen were lying in the streets with altered mental status, and they had no identification on them at all. Filling in the gaps of the information is how we believe that the BEMS app will offer an easy solution to an everyday problem for EMS.
So the first step to our solution would be to digitize the run report. Right now, run reports are currently on pieces of paper for EMTs to fill out at the incident. So we feel it would be a great approach to digitize the run report into an app so that EMT can go on their phone and fill in information on the fly during the incident. The second step to our BEMS solution would be voluntary inclusion. This would involve an app that would allow for patients to input their photo, their name, and as well as medical history, allergies, and current medications they're currently on, so that EMT can have that information with them so that once they identify the person, they can get that information and treat them accordingly. Our third phase would be to include biometrics in the form of a fingerprint. So with new technologies within mobile devices, we would want EMT to be able to scan the patient's thumbprint and be able to bring up medical history from healthcare providers, hospitals, wherever healthcare information is provided, so that EMT can use that information to treat accordingly.
All right, who of you have like an elder relative or someone with a health problem that you know? Yes, 1, 2. All right, so those are our first users. They're the patients, and they're the people that voluntarily provide their information. And to make the app easier for them, we made it professional, but user-friendly, because we want to inspire confidence and security within our app, but we also would like them to feel safe and have it. And we also, to follow that up, we will have a good security measure, and then so the EMTs are the only ones, and then. Next users are the emergency responders, and for them we have a very straightforward design, so they can see the information they need to see, whether it's conditions that the person has or allergies. And we have good data coverage, so if it drops out, it starts automatically looking for wireless networks and secure connection through Box, which is HIPAA compliant.
Okay, and this is an incredibly difficult problem. You think, what's the issue? You have an EMT show up to the scene, takes a thumbprint, gets the patient records. There are incredibly complex rules and regulations governing. Essentially what we focused on is privacy on the servers as well as on the EMT's phone in case they lose their phone, and then sufficient coverage. An EMT isn't going to use this unless they know that a sufficient number of the population they're serving is going to be in our database. So we've identified just small target populations with which to start a test pilot program.
Okay, in closing, I'd just like to say that we all know what's coming. The geriatric problem is coming up quick. Right now, we've got about 400,000 new geriatric patients per year, and that number is going to jump to 1 million or more within the next 10 to 12 years. The number of patients is going to greatly outnumber the number of providers. And what I would like as a medic is a way to accurately and securely retrieve my patient's information from a thumbprint. It will save time, it'll save money, and BEMS will make it easy. Thank you.
So you guys aren't all undergrads, right?
Yes.
You guys are undergrads?
Sorry?
Are you guys all undergrads?
Yes.
Okay. I was going to say, that's a lot of life experience for undergrad. Congratulations.
The late bloomer.
You know, I have a couple of questions. One, what does HIPAA stand for?
Health Insurance Portability and Accountability Act.
Wow. great. You know, most of the time when people say my solution is HIPAA compliant, I ask that question, they think one of the P's is privacy, and it's not. The intended goal of HIPAA, really, the prime directive, if you will, is the portability of health records. So you guys have touched on a really interesting solution, but I don't know that you guys have done the homework on the economics, right? So in major metro areas, it's not the senior citizens that are the part of the cost equation. It's homeless people. It's when a homeless person gets picked up by the ambulance and gets dropped off at county. It costs the city and all of us, right, thousands and thousands of dollars. Have you guys talked, I mean, you mentioned seniors. Have you guys talked to anyone in county or anyone that runs kind of these types of services in a municipality about what their real economic pain is?
No, I have. I've talked to the Veterans Administration because they were one of our test sources that we were thinking of because of the way they store their records. And the issue that we had touched on is that the stage 2 meaningful use, any medical agency that's receiving Medicare or Medicaid funding, they need to show 5% compliance that their records are being used in a meaningful way. And so that was one of the financial incentives that we were thinking would be beneficial to our app.
Well, so I think you guys have conflated two issues. MUS2, or Meaningful Use Stage 2, has multiple components, and it's quite complex. The 5% rule can be satiated by patients getting an email address and logging into some type of patient portal once, right? Or even requesting their medical records in some digital format. Email comes to mind, right? Again, I don't get a clear sense that you guys have done the homework on the kind of economics of the problem, right? Where did you come up? What is the genesis of this idea?
Well, I guess the genesis was streamlining the process of collecting the patient information. The way I see it, the faster you get from point A to point B, you're saving time, you're saving money. The idea that we would have a way to pre-populate the patient histories within our digital run sheet and send that ahead to a receiving hospital without all of the extra paperwork and that's going on now. Sometimes this paperwork gets lost. Like there's a lot of money-saving applications, I think, that would come out of this.
But this won't, again, this comes back to, I mean, how much homework did you guys do on the economics of this project? Because, one of the biggest lessons that entrepreneurs learn in their first startup is the marketing funnel or the cost of customer acquisition. Each patient record you guys get is going to cost you money, right? So it could cost you $300 to get a patient record that saves how much in time? And the other thing is, have you talked to EMTs that have used a tablet solution? Most of the studies coming out right now say that, in theory, it's awesome that they went from paper to a tablet in the ambulance. But in timed studies, it actually doesn't save any time.
Right. Well, I believe it's because they're still manually have to enter everything into a tablet.
Right, but again, you guys are ignoring the fact. What if it costs $300 per patient record in a marketing campaign to raise awareness of this?
Right. Well, we didn't have enough time to go into the economics of this.
Right, but that is the puzzle, right?
I think that you guys have some really interesting ideas, but it feels like you lack that singular focus right now. You're circling around a problem, but you haven't found the right solution yet. And so there were a series of disjointed facts that I felt were being loosely lumped together. I like the concept. I'll just go with one more. You picked a target demographic as far as signing up. It's John Doe, age 64, with Alzheimer's. Getting that demographic to interact with smartphone technology or tablet technology is really a big lift, and it's not just John Doe age 64, it's Sally Doe that's 74 or what have you. So this ultimately, I think that he hit the nail on the head. It's a social services opportunity, and if that can be the value proposition, really good. It feels like you're just around the periphery. A little bit more time, you get tighter and be really good.
Okay. All right. Thank you very much. All right. So next we have Team Outdoor. Sarah, Michael, Sean, Islam, and Daniela. There's a clicker here. Whoever wants the clicker. Here's the other mic. And I will let you know when to start, okay? Just so we didn't ask them, I understand your thing. We did not ask them to do any kind of financial. It does have to be feasible, I agree. All right, there's the clicker. All right, the judges ready? All right, whenever you're ready.
All right. Our country is facing an epidemic of chronic diseases caused by unhealthy habits, such as the decline in physical activity. Activity tapers off in the later stages of college and even more after graduation. And as expressed by many college students that we've interviewed, many feel confined to the gym on campus and they don't feel like they have the time or motivation to plan anything else. For example, outdoor recreation, for example, is a great alternative to the gym, but it requires a lot of planning, and we're hoping to provide an application that smooths out all the barriers.
So just to be clear, the focus of our target audience includes university students, but more specifically those interested in casual outdoor activity or outdoor enthusiasts. Based on the data that we gathered, this specific audience perceives indoor activities such as going to the gym as a task instead of having fun while exercising. And they prefer the solitude of the outdoor world, but are not willing to commit to a club on campus or a class. These users want to have fun while exercising, and they want to be able to share the experience with a friend and make it memorable. But due to the dynamic environment, individuals face problems of diverse proportions that must be addressed first in order for them to have a successful outing.
So, like he said, outdoor recreation really does present a lot of unique barriers that must be overcome in order for young people to establish and maintain that habit of getting outside and exercising daily, and we want that to happen earlier in life. So the way we can do that is we base this off the stages of change theory. We want to move people from that contemplation stage of when they're thinking about it and they're aware that they should make a lifestyle change, but they might not know how to go about it. So we want to move them from contemplating to action, where they can actually go out and do that and feel confident. The way we can do that is by reducing the time in between the two, and we can eliminate all the prep work for the user and have that transition be faster.
So what can we do about it, and how can we make it cool? Well, what if a digital, mobile, and most importantly, an interactive community of outdoor enthusiasts existed? Outpost is just that, an application that allows the user to research local outdoor exercise opportunities, plan those activities, and even see what other local users are doing that day. Outpost has two main functions. The first is the social media aspect. This is the central hub for most social functions of the application. The user can control their newsfeed by allowing all updates to display, or by applying filters on the left-hand side, such as photos only, friend updates only, or they can even post a question asking for advice or information from someone in the local area. Users can also update their profiles or view others. Profiles will be short, simple, and mainly serve to give enthusiasts a digital identity to link them to other users on the application. But there's also the research and planning function found by clicking the Start Exploring button. From here, the user can plan a private excursion, or they could do something social. For example, Sean McCloskey is hosting a hike at Mount Nittany. When they click on the link, they can see all the details. This function of the application might also be an ideal time for banner ads to local stores, such as Appalachian Outdoors or the Bicycle Shop. This all falls under something that we call value-driven social media. So share your experience and get outdoors, because the outdoors is about to be cool again. Thank you.
Oh, one of you can give them a mic.
But I freaking love this idea. No, I mean it's. Do you guys know the Airbnb story? You guys all know Airbnb, right? Forgive me for those who know this story already, but when it first launched, it didn't do well at all, right? And the eureka moment to them was when they retooled the user interface to be about pictures, right, instead of price. And so I love that you guys have figured that out already. Just in the 2.5 weeks of mocking up this UI, it's heavily picture and experiential, right? So amazing job, amazing idea. I would love to see this become an actual company. How did you guys think through the network effect? Meaning, if someone's into hiking, right, they're into hiking. If someone's into kayaking, they're into kayaking, right? How did you guys think through these folks kind of connecting with each other?
So this is just basically based off of my own experiences with my friends saying, yeah, you shouldn't go on that mountain today. It's actually really icy. The trailhead looks fine, but once you get in, it's really bad, and I fell. And so it's like, for me, it's about recalling all of those small little details when I really need them. And, you know, me and my friends will sit around and think, where can we go and fish? Where can we go and hike and bring our dogs? And all of these different things at the same time. And it just requires a lot of planning. So it was kind of like, if we could network and tell each other where the best spots are, or, you know, where not to go and where to go, it would just make everything a lot easier.
It's a brilliant idea.
I'll take the opposite approach. I hated it until you just said what you said. Because it didn't make sense to me. I'm like, there's Meetup, there's Yahoo User Good, there's everything. I can do this all over the place. I couldn't see the value proposition. It wasn't clear to me. And then all of a sudden you said that. And so I shouldn't been out mountain biking with my son on Work Trail where I went horizontal and I still hurt. Because if somebody had told me, you know, the rocks were really slimy on Saturday, I wouldn't have gone out. And so that kind of social dynamic that makes it something more than what it otherwise would have been, I think is fantastic. As far as how you market it, as far as how you make money off of it, things like that, we ignore that for right now. But I really like the social aspect of it. How do you entice, though, different user groups? How do you get the message out to college students? That's a demographic, I get that. But how do you get it out to other demographics that this might be a little bit foreign, to encourage them to do this? Because here's where it becomes very interesting. It becomes very interesting from a WellCare standpoint at corporations. How would you penetrate that?
Well, first, I just want to address something you said at the beginning. Just
that I hated it at first?
Just what you said. It's all over the place. Yeah. And that was what we were talking about. Like, I got out of the Air Force last summer, and then I came here up to Penn State, and I was like, oh, man. I was like, I used to live in New Mexico. There was nothing, and look at all these mountains. And I'm like, all right, I guess I'll go to the gym. Because I don't know what to do. I don't know where to get the gear. You can go to pahikes.com, and it's just kind of strewn about. Or one of your friends might say, hey, I'm doing this later, but nothing is completely integrated.
Get a purple lizard map.
Right.
Something else I just wanted to add was that one of the goals of this application is to make those people who, they may be slightly interested, they see everything going on, but they're not comfortable and they feel like they never could be comfortable. We're trying to target those people too, to say, hey, you know what, you can go out and do this, anyone can, like you just have to be prepared. And even the people who know a lot, you still find yourself with oversights every time you go outside, and it's like, you kind of want to make sure everything's accounted for. I think that the mobile technology is maybe only one of the ways to do that, at least for me.
And one more thing, obviously phone calls are way outdated now. I think even texting's outdated now. The way this group stayed in contact and made plans was we used GroupMe. The way my friends, I have like my different groups of friends, and we all have our own GroupMes. And I had no idea what it was until someone was like, hey, they're like, just add me on GroupMe. And I was like, what? And then I got in, and then I was in with this big social group of people, and I can just scroll through all my different GroupMe apps and see like what people are, doing. But primarily that's, hey, let's go drink. So this is something that provides that interaction, that group mentality, but also all these other resources to do research and find out, like she said, maybe I shouldn't go hike Mount Nittany today, it's going to be icy.
I think there's tons of, just to disagree with you a little bit, I think there's tons of ways to monetize. I could see someone, with the GPS antennas in our phones getting so much better now, I could see someone being, like the maven of the mountain. The personal tour guide, kayak fishing, it's actually a quiet multi-billion-dollar a year cottage industry globally, and something like this could really kind of unify it onto a single platform. Yeah, it's not a question. I don't mean to gush about your idea, but this is great. Congratulations.
Do I have time to add one more thing?
Sure.
One more thing when you talk about being cool, fitness, being in shape. It is cool right now. You just can't scroll through any 20-something-year-old's Instagram feed without seeing, like, at the gym, and, like, people love buying all these Nike clothes and these shoes and stuff. They probably only work out once a week. But on the flip side of that, there's a reason Appalachian Outdoors downtown is expanding. I highly doubt that 90% of the people even there are going out there doing these excursions, but wearing North Face clothes and having that image of like kind of being an outdoorsy person. It's cool right now. Being green is cool, and being a slob isn't. So, thank you.
All right, thank you very much. Thank you. All right, now we have Team Agro. Pat, Hermes, Kurt, Dan, and Angelica. Sign in, whoever. I will.
I need a mic.
Somebody needs to sign in. I'll let you know when to start, okay?
We do have to add to or not?
He's going to start. However, it's fine. I'll let you know when to start. Where do you? You got it? All right. Don't touch the screen. It'll go off. Okay. All right, hang on a minute. I'll tell you when. Okay, whenever you're ready.
Okay, so today we want to address a worldwide problem and bring it down on a smaller scale, see what our team can do to make a difference. Now, we all know that around the world, people suffer from hunger, but did you know that in Africa, 1/3 of children die every year from hunger? And that 1 out of every 3 people in Africa are starving around 365 days a year. So to make sure that people have access to food is to reduce food insecurity, and that is what our health issue is addressing.
Many organizations, such as the one I was a part of, Enactus, Entrepreneurs in Action, have gone across the globe to collaborate and work together with natives of another country to better sustain themselves through our partnerships. I went off to Rwanda to the city of Kigali, and we were able to build 2 greenhouses to help these natives provide food for themselves. Meet Marjorie. She's the director of the Star School. I was able to work and bond closely with her when I was there in Africa. After our trip, we started communicating via email and Skype to try to update the progress of the crops, but it became difficult. We just didn't have a place for all this concrete information. Here, this is where my idea stems off. An email between Marjorie and myself as I quote her. "Dear Angie, here are some photos of the greenhouse. I tried to send them to you several times, but it was hard. We want people like Marjorie to see themselves as farmers. The idea is to feel that we are on the ground even when we aren't, so we can see change. This stems off the behavioral theory. We've already addressed the issue, informational aspect. We want to have all the information there needed so they can go through these greenhouses and have the knowledge to do so. Skill building. We want to be able to stay and help them through our collaboration to continue the progress so that we can teach them the skills and allow them to reach that self-advocacy so that they have developed these skills. To reduce barriers, their ability to identify problems will help prevent bigger issues. And lastly, social support. We are available to them whenever they need us, as well as when we need them. Establishing a more sustainable relationship so that we can collaborate and help fight against reduced food insecurity. The solution here is through a network or a form of communication in which we can all reach on our mobile phones. This app is called Farm More. A play on words relative to farming, the concepts of food security, and sustainability.
Farm More aims to build a farm armor by helping farmers farm more and do far more for their future. We've identified 3 needs for the natives to achieve these objectives: provide information, manage their fields and crops, and communicate their issues. Farmers can input plants and then group them by location, whether it be an indoor greenhouse or an outdoor field. This information connects to an administrative panel that's accessible by the support organization located here in the States. This helps lower the barriers on the sharing of this kind of information. Beyond just managing, the plant details highlight key tips and reminders for plants at that stage of growth. Taking these tips and tracking the growth of the crops empowers them to become better farmers. The support comes through easy communication. Communication tabs throughout the app allow users to easily discuss the progress and issues while separating the conversations by the specific topic they're addressing. During implementation, we want it to be simple and scalable. We're not reinventing the wheel here. We're using existing web technologies such as web servers, Android and iPhone app stores, and the internet itself. The sustainability comes from the relationship that's built between the organization and farmers like Marjorie.
Future outcomes. We want to create a network where farmers can connect with each other. We want these farmers to be able to trade amongst each other. We also want a map to locate all the farmers in the area. We also want vendors to be able to access these farmers so that they can help them sell their goods for profits. It's estimated that 40% of what a farmer produces is kept for himself. The other 60% is decayed, meaning it goes to waste when there's people in those areas that are still hungry. And lastly, we want to create a more stable market and allow just food circulation in this area. Empowering farmers to do far more in the fight against world hunger. Let's start fueling this change in the world. Thank you.
Again, a marketing genius, you know. I would never think of this, but I'm an engineer, so stuff happens. I really, really, really like the concept. I really like what you're trying to do. But here's where I become disconnected. So when I was over in India last year, what they talked to me about outside of the big cities was power, education, health. Those were the 3 things that everybody kept talking about over and over. And they said one of the most empowering things outside of the main cities was the fact that there was a phone. And it was easy for people to use because it had a red button and it had a green button. And that's the type of phone. And they said it was very important to have those kind of phones because they would go to mobile charging stations and get charged for a week, 2 weeks. But very few of those existed. So that sets a vision in my head. So now I think about your target demographic. Do they have power? Do they have phones? And do they have sufficient education to use this?
Through research and being there in this group I was with, It's estimated between 5 to 10 years that they'll all be able to actually have like smartphones. Right now, they all have phones where they use SMS, they text, they're able to send certain photos. And we have people that are on the ground 2 to 4 times a year. So that will allow us to make sure that, we can teach them. And the teaching here would be just to use the app, which we want to make it very simple and just, that's the idea. We don't want to make anything too complex, just so that they could actually use it and we can connect.
Okay, that makes sense. I appreciate you putting that lens on that. This is a very forward-looking opportunity because right now, the target demographic doesn't have the training, doesn't have the education, doesn't have the technology at this point. So that helps me a lot. Thank you very much for that.
So, this is a friendly audience and panel. Once you guys graduate, if you guys do decide to be tech entrepreneurs, and you do this type of pitch in a demo competition or in front of venture capitalists, I think they will ask you, what the F do you guys do, right? So you guys have expressed a desire, right? But I don't get that you guys actually have expressed an idea, right? So I'm still unclear what the actual application is, or is it a nonprofit organization, or is it an app?
Okay, so I'll talk about the organization. The organization was a nonprofit organization, and we raised money through Penn State. It was a school-related type organization. So we had funding, we have certain things. We're on the ground 2 times a year. We have partnerships over there, people from World Health Organization.
You're not answering my question. What do you guys do? What is it?
The app centralizes the information that's needed to communicate between the farmers on the ground and the support organizations back here.
That's a desire, right? That's not a specific.
We track the plant growth and the issues they're having, and then communicate back to them tips on how to adjust what they're doing to fix these issues, and see how well their plants are growing without having to actually be there or ask them to send us pictures.
So is it a group or silo of soil experts handing out advice over SMS?
What organization here in the States that's student run? So
we're partnered with people that build greenhouses and go out there, and we've built these kits. So that's how we're linked with them. So to continue running these greenhouses, there's more than just, the greenhouse maintenance aspect. Those details are we have a greenhouse running for 5 years, the plastics, switch with so much. But this app would allow them to be able to access that information so they know different time frames of the greenhouse maintenance. And with that, the crops inside, we had a lot of difficulty just back and forth, how are your tomatoes looking, this and that. We need those details so we can further expand with them to make sure that they can continue this greenhouse so eventually they can sell to the people around in the area and so forth. So the main things we needed to work on is allowing them to be able to access all the information. We had manuals for them of certain things, but if we have all this, on this, they'll be able to see a tomato, all the details of a tomato, when to grow it, when to harvest, etc. And just follow these guidelines when they do have issues and those type of questions that you usually refer to us, which, right now it's basic farming things, we're just allowing them to have information and working together so they can just do the simplest things so they could have food. I don't know if that...
Well, so someone just mentioned GroupMe, right? Yeah. There's obviously message boards. There's PB Wiki, where anyone could create their own kind of industry-specific Wikipedia page. Is it just me? I'm not really sure what the idea actually is.
Here locally, I'm more familiar with what they're up to, so it's a little bit easier. But I'm challenged by the technology. That's such a big barrier to overcome. So one of the points of the rubric is how do you get this in the hands of the ultimate user? And yeah, the issue that I really bump into is you can't right now. All due respect, it's aspirational. And aspirationally, I'm going to bike up Mount Washington in a couple of months in 53 minutes. Not going to happen, but aspirationally, that's what I'm going to do. So how do I get there? And I see a disconnect in where you are, what you're talking about, and what it's going to take to actually make this impact. And because it's a disconnect for me, that gives me pause. The concept, I kind of get. The concept is you improve the farming methodologies and you teach people so that they can be self-sufficient, so that they can make an impact to the local communities that they're trying to be involved with. I like that. That makes sense to me, if indeed that's what you're trying to do. Yeah. It's just the technology link isn't quite there yet.
I mean, we originally looked through trying to do it and connecting it through like SMS, but, you know, through research and people that are still on ground, this is something that, you know, they will have between 5 to 10 years, it's estimated. Being out there, people have the misconception where there's nothing, you know, in Kigali or the area that I worked with specifically. You know, they're moving, they're growing, so this is something that they want to expand on. It's something that they're looking for. The other thing we thought that, like, even if they couldn't directly have a mobile phone on site, it would be that they could still use this, you know, on a computer, go to cafes they usually go to where they have Wi-Fi, and this is easy to, like, for them to go out there. You know, these people, these are their jobs. They go out there, they look at the greenhouse, they get all the necessary information, and they go in and put it. And it's still a database where we're all still connected. So there's ways to go around it that it could still work, even if we want to, like, go about it. And that's a great question, because that addresses that.
But at the end of the day, still, with the population that makes $3 a day, which is billions and billions and billions of people, it's a red button, it's a green button. And that's about all the education that, sadly, so much of those people have. So it's going to the cafe, I get it, makes sense, but it's a red button, it's a green button.
All right, thank you. Okay, last but not least, we have Team Stress Less. We need them. Harik, Brandon, Wes, Amy, and Anna. Somebody needs to get your thing up. Yes. Oh. Okay, I will cue you. I'll cue you when to start. Okay. Yep. Oh no.
My heart's beating.
What did you do? You should be down here. Yeah. You got time.
You use
this one?
Yeah, I think you use like this one. Okay. Yeah, you know, like this.
I'm good.
Oh, perfect. All right, now we gotta get it back. Hang on. No, don't do that. Don't do that. Okay, all right. I don't think it goes that way. All right. But now that was going to mess with the mics. Okay. Okay, whenever you're ready.
Good evening, everyone. Our app is called Stress Less. So if you look at some of the top disabilities and diseases in our country, you'll have conditions such as cardiovascular disease, obesity, and diabetes, all of which have a common risk factor of stress. So our purpose of this app is to provide college-age students healthy coping mechanisms in hopes that they would practice these healthy coping mechanisms throughout their lives. Overall, we want to reduce stress-induced diseases and improve overall health. So, what is stress? Stress is defined as a state of mental or emotional strain caused from a variety of lifestyle reasons. This could be work or school. Physiologically, stress can produce a hormone called cortisol, and what cortisol does is it suppresses your immune system, which makes an individual more susceptible to diseases and infections. Also, stress impacts all areas of life. This can include your physical health, your social health, and your mental health. Our target audience is undergraduate college students who are stressed because we sadly have to deal with things like this. Okay. In a study conducted in 2012, it concluded that more than 1/3 of college students are seeking help for severe psychological problems. Our levels of impact, we're looking at a short-term, immediate, effective way that reduces stress right on the spot. At the long-term perspective, we're looking at we're trying to integrate healthy coping mechanisms that can reduce usages like alcohol and drug use, so that these people can incorporate healthy lifestyle habits throughout their lifespan.
In designing an app to relieve stress, the user experience is absolutely critical. So in order to assure them that we're going to calm them, we start off with a screen such as this that would be animated and just get them relaxed right away. And to accomplish this user experience, we did this in 3 key manners. The first is through the aesthetics, which is a clean and elegant interface with it doesn't confuse the user, it doesn't overwhelm them. We use icons instead of text where possible. And next we use a fun and easy mode of navigation. The gestures, or we incorporate gestures wherever possible because it increases the level of interactivity with the user. It forms a more emotional connection with them, and as such it has an intrinsic calming effect. And lastly, we incorporated a bunch of scientifically proven ways to reduce stress, such as our stress log, calming pictures, soothing sounds, and tips and tricks to help them with their lifestyle.
So the stress log feature keeps track of the user's stress levels by prompting them to answer certain types of questions, fill out that chart from 1 to 5, how stressed they are, and even check certain types of checkboxes that pertain to them.
We try to incorporate larger fonts, as you can see. This gives the user an easier reading experience. We also worked on what we call extrinsic motivation, which offers our users to choose their own rating from a scale of 1 being they're cool as a cucumber to 5 they're extremely stressed out.
The information we get from the log is then displayed via graphs, which the user could potentially take to their clinician if they wanted to.
Through our research, we found that giving users the option to see their graphs and visual representations help them relax.
Funny pictures, pictures of cute animals, pictures of beautiful nature scenarios are all proven to reduce stress.
Our users will experience a stress-free environment when they go to this page. We try to incorporate a swipe interface, which makes it easier for the user to navigate through the pictures.
We would also try to pertain to the user's senses by using soothing and relaxing sounds, kind of like what you're hearing right now.
As you can see, there are a lot of content in this page. We tried to keep the design as minimalistic as possible, and we incorporated a lot of visuals, so the user will just tap on one of the visuals to activate the sound that they would like to hear.
And lastly, our tips and tricks feature would provide funny jokes, stress-relieving suggestions, and motivational quotes, all which could be pushed to notifications so that we could actually try to achieve to reduce this user's stress levels without them even having the app open if they choose so.
As you can see, this page contains a lot of text, so I tried to incorporate what we call stress-reducing colors. In this case, I used soft blue, which gives the user a calming experience. So in conclusion, what we can say is that our preliminary feedback shows that the users would love to use this app, and they're going to enjoy the experience. That's all stress-free.
Thank you.
First of all, I have to say that this is the best example of why IST and BBH should work together, because when you put that equation up, I was comfortable. When you were talking about whatever the definition of stress is, I was freaked out. So, you know, I mean, it's like, whatever. You guys are wigging me out. Hardest thing to do in life as it comes to technology is user interface, user experience. I have to compliment you because I didn't hate it. I actually really liked it. So you guys put some thought into it. The music worked. I was kind of chilling, and I think that this was really, really, really well done. What I didn't understand though is who really would use this? Is it college age? Is it middle demographic? What could you explain to a little bit more of your demographic? Thanks very much.
We chose college-age students in particular just because this is the first, not necessarily the first time, but it's when we start I guess we start experiencing a lot of stress. So since we're starting to experience a lot of the stress, we want to promote healthy coping mechanisms, not bad ones that some of us do already, but we just want to introduce them to healthy coping stress mechanisms in hopes that they would do these helping coping mechanisms throughout their lives.
I think college-age students are perfect as well because they're already an established user base. They're more open to downloading apps and using it as opposed to, say, an older audience. So I think that...
I think the older people in this building find it adorable that you think college is stressful. Don't get older. That's my advice. No, you guys did a really good job on the UI. It's very Uber-ish. It's very clean. My only question is the data self-selecting? Have you guys thought about that? Like, so is it going to text me 5 times a day and check on my stress level, or am I more prone to open it when, my girlfriend's screaming at me, right? In which case the graph's always going to be like a straight line of 10, right? Have you guys thought about that?
Well, the way we have it set up is the notifications the user has to turn them on before it ever buzzes you with anything because that can be stressed out if you don't want it. So yeah, it's basically the user will have to open it whenever they're stressed and, give them tips and tricks.
I just want to mention that we actually did a pre and post survey about like the features of this app, and what we found was that the app, like there wasn't one selective feature that some of the students liked more than others. So that's why we incorporated so many features of this app, if that makes sense.
It does. No, I mean, I think your UI is clean enough where you can have literally 12 icons on an iPhone 5, right? But I don't think you guys answered my question. How do you get accurate data? If I only open that app when I'm stressed out, then how do you guys report my stress level?
Okay, so we actually did think about this. Actually, we were just discussing it yesterday, and what we said was that, of course, people are going to click on this app whenever they're stressed. But since we have so many of these features, we were hoping that people would just go on there. We were hoping that they would just go on there on their free time, and we were gonna open the log like once a day. You know how when you go on like Vine or something, they say like rate this app. We would just say record your stress level today. So that would hopefully not skew the graphs.
And I'm not throwing cold water on this idea. I was actually given a presentation in San Francisco, and the guy that came after me blew me away. 10 times better presentation than mine. And it turned out that he's a chief joyology officer. And he works at companies like Google, and where he actually talks about things like this, about how to manage stress in the workplace, right? But he did mention certain types of stress are good, right? Like we grew up in like the Paleolithic days, right? Where as human beings, right, we heard a twig or a branch snap, and we were on alert because it was a saber-toothed tiger trying to eat us, right? I think you guys are researching a really emerging and interesting industry. I think the puzzle is how do you get that data, right? Again, it's the second team that came up had the question about how do you get continued engagement? How do you guys get continued engagement so that you properly measure stress and then you balance good stress, the twig snapping, right? Keeps you motivated, right? You want a good grade, stress, you study, with bad stress, the kind of stress that you were talking about in your first couple of slides.
So there are 2 types of stress. So there's like stress that gets us up every day, and there's like stress in which you're really just stressed out and are just so frustrated. So this app was leaning towards more of that stress that I'm very frustrated, not, oh, I'm stressed, I have to get up in the morning. So it's not necessarily the acute stress, it's more of the, not severe, I would like to say, but more of, I guess, the frustrated stress, like I'm, you know what I mean.
And additionally, the graph that we showed, it has the ability to show different time frames. So even if the user doesn't enter when they're not stressed, you can still see emerging patterns when they are stressed, say maybe on Mondays or during exam times. So I think that's one way you can look at the data.
Good job, guys.
All right, thank you very much. All right, we're going to sit tight. The judges are going to confer. While they're conferring, I want to do some thanks. I want to thank Dean Hall, Dean of David Hall, and Mary Beth Rawson, Assistant Dean for Undergraduate Studies, for supporting this, giving us this wonderful venue, and helping us to do this. Meg Small, my partner in crime, who's done this with me twice, and Health and Human Development. And we could not do this without the faculty advisors, Irene Petrick and Joe Geikes, who volunteered their teams, their classes to do this, so thank you. Okay. And I want to thank Lee Carpenter and the Startup Committee group, and we're actually going to get on some student-run television stuff here, so this is pretty cool. So all right, so sit tight. You guys do your deliberation, and we'll be back. We should get that stress-reducing music on. Three. Yeah. So we're looking for the top three. Yeah, what we'll do is I'll announce third and have them come down. Okay. I'm going to tell everybody to wait so we can have pictures. Because then, to sign everything. Yeah, and then you have stuff for the judges. Yeah. We do that. Prizes. Yeah. First, second, and third prize.
Is it like money? Or
Yeah.
Okay.
Yeah.
I didn't know if there was like a physical trophy.
No. It's $100. I didn't make it. Okay. Yeah, I knew that. Yeah, I'm going to announce it. They're going to come down.
Are you having them go back to their seat? And then
No,
announce
I'll
the
have
other
them.
ones?
We'll just have them stay.
Okay.
Yeah.
Okay.
And then at the end, I'd like to get a whole group shot.
It's best to go up to the atrium. This way when it stops.
Is it?
And I'm not allowed to use flash.
Even at the end?
Talk to Joyce. She's coming in flash.
Is Joyce here?
No, but let's go to the atrium so
Okay.
nobody looks orange.
Oh, okay. So we'll do first, second, third, and then we'll go up to the atrium. Right, the 1, 2, 3, and then we'll do up and do. Yeah. Okay. Okay, for the participants, you want to hang around. We're gonna do pictures up in the atrium afterwards. So, and then we have some signy things. So don't leave us. Don't leave us. What?
Oh, we gotta find something to give her. For Meg's.
Did Meg tell you she got that award?
Well, I'm sure Meg will write a letter.
She got
for
that
you.
alumni award that I asked you for a letter for. Excellent. Did I not tell you? Well, you know, our public information people just I kept saying, don't need to write it.
Oh, that's great. Oh, I'm glad.
Yeah. Well, I was really surprised because when Mark Greenberg said, let's do this, he said, it'll be years before she gets in because, they nominate and then you don't